and we're working to make sure that there's video visitation available as well. And as we continue to look at this crisis and its impacts on those who struggle with substance use and mental health conditions, we want to announce the following today. In partnership with the Ohio Department of Medicaid, we are filing emergency rules to expand telehealth options for individuals struggling with mental health and substance use disorders. These new rules will allow complete geographic coverage of telehealth services throughout the state of Ohio, in every home, through just a simple landline. This is important because we know that broadband and cellular service aren't available in every community, and this, in fact, is something that the Lieutenant Governor has been taking on in our state. This also eliminates the need for special equipment to connect through video conferencing. So now these actions will allow professionals and their patients to use normal cell phones and applications like FaceTime to connect through video conferencing in order to receive the services they need to continue in their mental health and addiction recovery. It also allows us to eliminate the requirement that a person be seen for their first appointment in person with a professional. And so if that person hasn't, if an Ohioan hasn't had a mental health or addiction issue or sought treatment for that in the past and they want to do so now during this emergency order, they will be able to have that first appointment through telehealth rather than needing to be seen in person for that care. These are important actions for us to take to make sure that people can still get the mental health and addiction services that they need, so that we're protecting the patients from potential exposure and the workforce from potential exposure. This is really intended to keep everyone healthy in all ways, not just physically, but mentally and emotionally as well. And we're also committed to everything that we can do to make sure that those struggling with these disorders are able to access the medications that they need. So last night, the Federal Substance Abuse and Mental Health Services Administration approved Ohio's COVID-19 opioid treatment plan. These plans were distributed yesterday to our community treatment partners in the state. And the organizations that I'm talking about offer important addiction treatment, which involves medications, psychological therapy, and other recovery and counseling services. Their continued operation is essential to our state, its citizens, and to our commitment to supporting people affected by the opioid crisis. So specifically, the plan includes opportunities for them to work differently in the regulatory structure to respond to the needs of the patients that they're seeing today and the experiences they're having today. These critical providers are getting guidance on how to manage their operations to reduce risk of exposure for patients and staff, and guidance on how to make sure medication is available to those Ohioans who are unable to come to a treatment center now because of the risk that they may have COVID-19, but they will be able to get the medication in their homes. My agency also understands the importance of access to medications through all of the treatment providers and state facilities, not just the ones talked about in this federal guidance. And so our Ohio Pharmacy Services, operated by our department, has worked over the past several weeks to ensure that we have adequate and sustained supplies of medications needed in the state's facilities and for our community partners that access these stores. Our every intention is to make sure that medications are available for people with behavioral health and addiction issues and the other medications that they need for their care in our institutions. So I just want to take a minute and say to all of our friends and families living with mental illness and substance use disorders that it's important to know that we want you to stay healthy and well in all ways, to continue in your recovery, and to follow the instructions that we're setting forward, and to know that if you have a mental health need or an addiction services need, we're making every effort to make sure your access to those services are in place. We are asking that if you're not healthy, if you're experiencing the symptoms that Dr. Acton and her team are communicating, that you should be working with your healthcare provider, your local health department, and ensuring whether or not it's safe to go to treatment. Call your treatment provider first. figure out how to get the services you need in your home if you shouldn't be going to the treatment center, but also don't skip appointments because you're afraid of exposure. We want you to get the counseling and other services that you need. We want you to stay healthy and well in all ways. If you have any questions or concerns, please call the ODH hotline that's been set up and ask. Call 1-833-4ASK-ODH in order to get the individualized questions that you have answered for you and your family members in accessing health care and mental health and addiction care as well. It's everything